Welcome to the Stanford Healthcare Nurse Residency Program Interview Preparation Webinar. I'm Leticia Cortez, and I'll be facilitating today. We ask that you please mute your microphone and hold all your questions during the presentation. Following this presentation, there will be dedicated time for a Q&A session with a panel of current nurse residents. Note this webinar is being recorded. The recording will be posted to our careers page within 48 hours. I'd like to take this opportunity to introduce the Nurse Residency Program team. Coordinators for the Nurse Residency Program include myself, along with Christy Norris. We are both nursing professional development specialists who directly support the program. Carrie Voss is the Director of Transition to Practice Programs here at Stanford Healthcare, and that includes the Nurse Residency Program. We also have part of our team, our HR partner, Carly Dye, who is a Senior Talent Strategist. So we'd like to all welcome you to today's webinar. I'm excited to have three of our nurse residents join the second half of this session. We have Amaya Clark, Leanne Belostas, and Annalise Prestosa. They're going to be sharing their experience in the interview process here for the Nurse Residency Program, and they'll join us and do some introductions in the second half. So let's just do a little review of who we are as a Nurse Residency Program. We are a recognized Vizient Nurse Residency Program since 2006. We are nationally accredited Transition to Practice Program since 2021 through the American Nurses Credentialing Center. And I apologize, I have to do a little break. Hot off the press since 10 a.m. this morning, we are now accredited with distinction. So it's a very prestigious honor that our program was earned this morning, and we had just got the notice. So you are the first to hear that. So thank you very much for being here for that announcement. We've successfully transitioned the practice of newly registered nurses each year into the following clinical settings. So we've transitioned nurses into the critical care department, the emergency department.
Right now.
Sorry, emergency department, inpatient medicine, surgical, oncology, dialysis, perioperative, clinical trials, psychiatry, BVOR as well. I just want to give an update on our invitation for interviews. So our program has not yet started sending out invitations for the Nurse Residency Program panel interviews. We have completed all screenings of the application and are reconciling positions. So once that's completed, panel interview invitations will be sent out, and invites can be sent out as late as June 13th. And we'll go over a timeline in the next slide. Additionally, we have not finalized the number of positions that will be extended for this cohort. And so we just wanted to give everybody here an update of that's what's going on currently. Our panel interviews will go out, offers will go out in a rolling sequence. So once those positions are reconciled, it'll go out in a rolling sequence. Batches will go out, allow time for responses before releasing another batch. Once a candidate accepts an interview date and time, an auto-generated email will be sent to the candidate within 24 hours with information regarding the interview with the corresponding Zoom link. So if you respond to this auto-generated email and you don't receive a Zoom link within 24 hours, do email newgradrn@stanfordhealthcare.org. Following panel interviews, unit level interviews will be scheduled, and the date and time of this is at the discretion of a hiring manager. Unit level interviews will be completed with final offers made to human resources by June 27th. And just another, with all this email correspondence, you want to be checking your junk or spam folders. Oftentimes, if there's an issue, that's the first place we refer someone to check. I'd like to visit the cohort timeline to recap where we started with this cohort and looking forward to the beginning of cohort 43. So applications were open in March to early April. Panel interviews will begin June 16th through the 20th. And unit level interviews will follow the week of June 23rd with final offers to HR June 27th. Cohort 43 will have a start date of August 18th. A frequently asked question received around the start date is when you will start working on the floor. If you were offered a position for cohort 43, the start date is August 18th. So your orientation on the floor will start 1 week after the week of 8/25. A key date to note is July 11th. If an offer is extended to you, you must have your California license by 7/11, so try to keep that in mind. And that means your license is posted to the BRN. It can't be the date of your NCLEX test. But should you not make that deadline, the job offer will be rescinded and you'll be welcome to apply to cohort 44. So you should still meet the application requirements. Okay, so currently we're going to go over the nurse residency program structure. So we talk a lot about phases, or we refer panel interview or unit interview, and we're going to go over what those two look like, how they differ. So phase one is referred to as panel interview. So what that is, it's a virtual interview via Zoom. The specialty area managers are present for that interview. So if it's a medicine panel, their managers for the medicine area are present. Oncology would be oncology managers present. And then with that, you have the managers on the call, and you have 4 to 5 candidates per panel. So it would be you and 3 others, or you and 4 others who are interviewing with these group of managers. The type of questions you'll be asked is behavioral style interview questions. More on that in a few more slides. At the end of this panel interview, phase one, there'll be no opportunity for questions. So the interviews last about an hour. They conclude, your facilitator will give you some next steps and some directions on what to expect. If a manager on the call feels like you're a good fit for their unit, they'll reach out to you and schedule a unit level interview. So this is phase 2 of the interview process. Phase 2 unit level interviews occur in person. So they'll arrange a date and time for you to come to the hospital. The unit manager will be there and you'll be greeted by the team. So that includes the assistant managers, maybe the educator, some unit staff, and maybe a clinical nurse specialist. Whoever's part of the team will be part of that, and that's up to the discretion of the manager, so each unit's different. There'll be 1 to 2 candidates present on the interview. So it could be you with just that team, or it could be another person there. This style of questions can also include behavioral style interviews questions, but also candidate-specific questions. And what those look like would be, tell me about your journey to nursing. They might want to know more about your capstone, maybe any of your volunteer work experience. And then they also might just want to know a little bit more about you and just more personal, what you like to do in your free time, anything like that. So this type of interview differs from the panel interview because there will be an opportunity for questions. So we recommend you come prepared with questions that are important to you. So this is your first nursing job, your first professional role in healthcare. So you might want to ask, what makes a nurse resident successful here, or what are some challenges that they experience? What are some unit goals that you have, or what would nurses say about working here? Whatever's important for you to know about a prospective unit where you're going to start your nursing journey as a registered nurse, that's important. You should ask it at this time. Okay, so let's discuss the panel interview process. So you'll be provided a Zoom link for a specific time you were scheduled for. When you log in, you'll be placed in a waiting room until the interview facilitator opens the room. So my suggestion is that you log on no more than 5 minutes prior to the meeting. So if this is a 10 o'clock interview, 9:55 is appropriate. And when you log in, be sure that your name on your profile, you could look at it how it says now, mine says Leticia Cortez, that it's your name. The facilitator is going to be looking for the candidates who are supposed to be present. So if you share a Zoom profile or you share a computer, laptop with someone who you live with, their name might pop up. So you want to make sure that that's correct. Once the facilitator sees everybody's present, they'll let everybody into the meeting room and they'll have some introductions and instructions. So they will open up with introducing themselves and what to expect for the upcoming hour. Then the hiring teams on the panel will introduce themselves. After the hiring teams introduce themselves, it's time for the candidates to have introduction. So when you're preparing an introduction for an interview, you can structure it however you like. There's no real template that you have to follow, but what most people do, or what a good place to start, is to start with a high-level overview of your resume and include where you went to school, any relevant work or volunteer experience, and any other pertinent or relevant information. This is your opportunity to not only connect and share information, but also make a first impression. So this means to, yes, do prepare, but it doesn't mean that you can't be yourself. A lot of people take one or the other. So believe it or not, also candidates oftentimes don't prepare an introduction. They think like, well, I'm just going to talk about myself. It should be easy, but You want to prepare so that way you can find a way to infuse your personality and your voice in this introduction while explaining everything that you've accomplished thus far. You want to organize your thoughts and information that you want to share into a clear, concise way, and that way it could keep the introduction to about 2 minutes. You want to practice ahead of time so that your best self shines. After the candidates have introduced themselves, it's going to be time for questions. So everyone on the panel will be asked 4 questions, all 4 of the same questions. Interview questions are going to be asked in a rotational sequence so that each candidate will have the opportunity to be the first to hear and respond to 1 question. So what that means is you will know the other 3 questions you're going to be asked ahead of time because you will hear the questions asked to the other candidates. After each candidate has been asked every question, the interview will conclude and the facilitator will provide next steps. Now that we've gone over the cohort timeline, interview panel, structure information, we're going to move on to behavioral style interviewing. So don't worry if you've never had this interview style utilized before. Behavioral questioning focuses on a candidate's past experiences. So you're going to hear questions phrased to prompt an example of your experiences, such as, tell me about a time when, or give me an example from your previous experience. Questions focus on a candidate's past experiences by asking candidates to provide specific examples of how they demonstrated certain behaviors, knowledge, or skills. The answers to these questions should provide concrete evidence as to how the candidate has dealt with the issues in the past. This information will serve as the best predictor to determine how you will respond given a similar situation in the future. This interview structure allows the hiring managers on the meeting to objectively compare candidates. So not everybody has had the same level of experience or exposure in their clinical environment. So this really levels the playing field so that everyone can participate, no matter the exposure they've had. So suppose you're asked a question and you feel that you haven't had that experience. We recommend not to say, I haven't had that. Instead, take a minute, think about the question, and respond to the best of your abilities. The questions are general enough that you've likely encountered or observed a situation similar in your clinical experiences through nursing school. In the panel interview, you will not get questions specific to, the rate and ratio of compressions, or asked to describe lab values or recite pathophysiology. Rather, questions are going to sound more like, tell us about a time you had to escalate a clinical concern. So clinical concerns can include a change in vital signs, pain unresponsive to treatment, or incorrect medication order, or maybe you just have a general uneasiness about a patient's progress. So in terms of your response, it's not about how complex the issue is that warranted the escalation. The focus will be how you responded and what were your actions, what was your thought process. So this interviewing style also allows us to assess critical areas of the job requirements, as well as the critical elements that are important to the broader culture of our organization. So that means that not everything's going to be a clinical scenario. They're going to be looking at how you approach situations, how do you work on a team, how do you treat others, how you demonstrate empathy, in addition to the clinical skills and knowledge that you have. So you might be asking yourself, okay, well, where do I start? I know what this behavioral style is, but how do I start for this? So we recommend a 3-part approach, starting with prepare and practice and finishing with perform. So we're going to start your preparation with a brainstorming activity. So before moving to the next slide, just with a clear thought process right now, I'm going to ask you to think of some qualities of a clinical nurse. If you have a hard time doing so, think of a nurse who's inspired you. What did they say? What did they do well? What traits do they carry and perform? Maybe they were organized and always seemed 2 steps ahead of the day. Were they the go-to person when a situation needed to be de-escalated? Did they effortlessly deliver care, just talk to patients and families? You can use all these traits just to start your preparation for your interview. We'll go over how to do that. So in this diagram here, we have many qualities of a clinical nurse. So you might have already thought of them. The others you should be familiar with, like teamwork, delegation, advocacy. And now think of experiences in which you've demonstrated those qualities, right? So times you've demonstrated delegation or escalation, times you've had to communicate or been involved in conflict resolution, or maybe you had to reprioritize tasks and care. So when you think of those, you could ask yourself, okay, well, what happened in this situation? What part did I play? How did I respond to the situation? What were my actions? And then ultimately, what was the outcome? What ended up happening here? Keep in mind, you're interviewing for the role of a clinical nurse. So many times we have candidates who use experiences from their current roles in healthcare, where the scope and intervention is different from that of a nurse. It's not to say that's not correct, but we want to encourage you to focus your answers from a time you were functioning in the role of the nurse, because if not, the panel might see you in the role that you're describing instead of that, of what you're applying for. So as mentioned previously, if you feel that you don't have a clinical example and need to provide one similar, that's okay. But just try to keep as many focused in your clinical experiences as you can. Okay, so now that you have some experiences related to the traits, you're going to organize the stories in a format that you can easily recite during an interview. So the comparison would be, just to keep it, organize each story in the way of an ice cream sandwich. So you have cookies on top and bottom and ice cream center in the middle. So the top cookie is where you would set the scene. So you're beginning a story, and then this ice cream center is the star of the show and what is being assessed. So it's going to be answering those questions of what part did you play? How did you respond to the situation? What was your action? Then you round out the story with the outcome. So let's go over an example of how we would do that. We'll be brainstorming. So tell us about a time you activated resources to provide care during your clinical rotation. So starting with the top cookie, well, what happened? Maybe during your med-surg clinical rotation, you had to provide wound care for a patient and you weren't familiar with the instructions or the type of wound care that was being ordered. So the ice cream center is where you start to ask those questions. Well, what part did you play? Were you the primary nurse? Were you gathering the supplies and quickly noted you've never performed this type of dressing change? How did you respond to the situation? You gathered more information by reading the wound nurse's notes. Maybe you watched a video. Maybe you reached out to your preceptor and educator for some just-in-time training. Or maybe you referred to the policy and communicated to your preceptor that you've never performed this type of care before and shared all the work you did to try to understand the order. Or did you involve other members of the care team by messaging maybe a wound care champion on the unit? You coordinated time to perform the dressing change before the scheduled time. You made sure that all the supplies were there. You had other patients that you went and rounded on, let them know you'd be in another room and that a break nurse would be covering for you. And then when you had time, you were going to go in with the wound nurse, you introduced them and that they would be helping you. So just think about how you demonstrated these actions. Instead of just labeling or stating the actions, really walk through and get the descriptions out. Walk through your thoughts and your actions. So we don't need an over-the-top example to demonstrate your abilities at a high level. So when you complete the story, what was the outcome? So you were able to provide full care to your patient confidently with the support of a subject matter expert as your guide. You now know how to perform a specific dressing change that you were unfamiliar with. And you found that many people on the unit were unfamiliar with it as well. So that unit champion made a tip sheet for everybody to now be informed of how to perform this dressing change appropriately. So if you notice, I demonstrated multiple qualities of a clinical nurse. So such as resource utilization, delegation, teamwork, effective communication, and coordination. So when developing the scenarios, you can have multiple qualities woven through, and that's because that's exactly what we do. We're never just performing one task or demonstrating one trait. It's just when you are answering the question, you want to highlight the trait that's in question. So organizing the story in this format is going to do a few things for you. So it's going to help you prepare a clear and concise, well-developed response. It's going to keep you on topic. It's going to make sure that you're developing that ice cream center of the sandwich, right? Keeping you at the center of the story. You're the star of the show. And lastly, it's going to help you be able to find your place should you get lost or distracted during the interview. Okay, so after brainstorming and preparing organized scenarios that highlight your performance as a clinical nurse, it's time to practice. This is a majority. You get all those stories, get all the examples, and practicing is really going to make an impact on your performance. So you're going to review stories and experiences so that you feel comfortable sharing these experiences. So when you're choosing the stories after you've brainstormed and you have a few, choose those that are not overly complicated. If the story is complicated and hard for you to explain in 2 minutes, it's going to be hard for managers to follow that. Ensure you're the key player in these stories. So remember to emphasize you're part of the ice cream center. You're the star of the story. After that, you're going to create mock interview questions and select them at random. So we suggest you write down some questions, put them in a jar. If you have a little satchel or like a makeup bag, you could put it in there and you could just pick them out at random and share your story on the spot. So referring to the traits of a clinical nurse, such as advocacy, we write down a question for it. For example, we could say, tell us about a time you had to advocate on behalf of a patient. If the trait was teamwork, tell me about a time you worked on a high-functioning team or when your team wasn't functioning. For compassionate care, tell me about a time you provided compassionate care. So you're going to take all the questions that you develop off these traits. It's not an exhaustive list that we went over. If you could think of anything else, throw them in there. Take them, put them in that bag or the jar, and pull them out at random. So you could do this almost anywhere. So you could pick your practice while you're in the car waiting for your food order or your store order. Maybe you're waiting in line for your kids to be out of school. I know this is a lot of people stream, so there's not a lot of commercials anymore, but if you're watching TV and commercials might be on, it's a perfect opportunity to practice. It's like the right time between commercials. So the time pressure of 2 minutes makes most people nervous, but the majority of nerves comes from the element of surprise. So you want to practice so that factor is reduced. Just keep on practicing scenarios, and by picking out pieces of paper, you should have, quite a bit of them in there. You could really just keep that surprise element a factor for you. So other things that you could do to practice, you could speak out loud in front of a mirror. This will allow you to see yourself and catch not only what you say, but how you say it, how you're connecting. Are you making eye contact? I know it's a camera, it's a laptop or a computer you're looking at, but you could still pretend that that's somebody you're connecting with. You can record yourself. So this will help seeing how you present yourself, how you practice connecting with the audience. So the mirror is in real time, but you don't have anything to reference back. Having a recording is a really good tool. It's very uncomfortable. A lot of our nurse residents who have been hired will share that, but they say it was really effective in helping them prepare for this interview. It'll catch a lot of your ums and ahs that you might not catch when you're practicing without recording. If you commute a lot, or if you're spending a lot of time in your car, one thing that you can do is use a voice text app or a voice note app. You could record yourself in that way and then play that when you're driving. So it's not that you need to watch it, but at least you can hear yourself. It's just another tool that we've heard is effective. You could practice with a friend. You can give them the questions and have them pull from the pool of questions, and you'll have all the elements in an interview. You'll have a real person to connect with. You'll have the element of surprise. They could time you. You could see how you connect, and then they can give you feedback of how your response was. The more you practice, the more comfortable you're going to feel when you sit for this interview, and the more you're going to be able to let that true self shine, because those nerves have been put at bay with your preparation and practice. So practice, practice, practice is what's going to help you really be natural in an interview. Okay, so when we look forward to performing, this is going to be the interview time, right? So you've already prepared, you've gathered scenarios, you've developed questions, and you really put that into play in all of your practice. So when it comes time to perform in an interview, you want to make sure that you position yourself in a quiet and comfortable space. You're going to ensure that there's proper lighting. So if you know the interview is at 11 a.m. or 1 o'clock in the afternoon, make sure the lighting in that area where you plan to do the interview is optimal. You'd want to be troubleshooting backgrounds or lighting on the day of your interview. You want to limit distractions if possible. So if you have family or you have roommates that you live with, make them aware that you're having an interview at a certain time. If you have any fur friends that like to make appearances, or we have animals that like to lay on laptops, you want to make sure that they're, have some things to keep them distracted and keep them busy so they don't call attention. If you have yard work or things going on, maybe choose a room that's away from that so the noise doesn't travel there. You want to ensure you have the charged device, so you have some backup power, maybe you have a hotspot if you have any connection issues, or you have your phone charged as well. You have the link available at any device that you're going to use. You want to wear professional attire. So I know it's a virtual interview, but you still want to present yourself as if you were joining on a live interview. Okay, and then you want to listen carefully to each question. Like I said, each candidate will have 4 questions. You want to listen to them. You want to ask for a question to be repeated or ask for clarification if you need it. Don't answer the question until you fully understand what's being asked of you. So a lot of times you will hear what the other person responded and you think that that's what the question is, but just take the time when it's being you getting the question. You want to listen fully, get clarification if you need it. Also, you want to answer all components of the question. So most of the questions have a few prompts with them, so you want to make sure that you are listening. That way you can answer each prompt. You can write down the questions if needed, so take a little time to write some notes when you're being asked or when you hear the other questions being asked to the candidates. But use these just to jot your memory, not to have a full response transcript. It doesn't come across well when you see somebody reading from a screen, so you want to make sure that you've practiced enough so you can speak naturally, you know the flow of the story. You can have written aids just to help direct you and make sure you're answering everything, but don't read from your screen. You want to slow down, don't rush your answers. Rushing will really aid all that preparation right out the window, so just be mindful of your responses before you begin speaking. If you're nervous, just remember, this is simply a conversation. They're just trying to get to know you a little bit better. So to remember to breathe, interact with the panel, show them your personality, and remember it's both what you say and how you say it. So looking to some behavioral style interview questions, we'll give you some examples. So starting with, this one is about reprioritizing care. So tell us about a time during your clinical rotation when you needed to quickly reprioritize care. What happened? What actions did you take? And what was the outcome? So was there a shift that you can remember where you had a plan, and you had a plan for the day, you had a plan for your patients, and due to clinical circumstances or maybe some time-sensitive needs, you had to reprioritize these tasks or your plan for the day. So you can ask yourself questions to further develop the story. So you want to make sure that you answer the prompts, but let's further develop it. So you could ask yourself, well, how did you determine the top priorities, right? Did you ask for help? Did you delegate? Did you feel that? And then after all this, when you kind of go through the story, you can ask yourself, do you feel that those choices were valid? Would you do anything differently, right? So giving some perspective of what you maybe can and can't use in the response. So not everything that you are going to come up from developing this story is going to be something you use in your response, but it'll help develop and maybe use a little bit of information to develop some background. The next example would be, tell us about a time when you experienced a challenge communicating to a clinical colleague, so be a nurse or provider. What happened? What actions did you take? What was the outcome? So was there a time you used maybe a written messaging? I know some places use text or they use similar text or they use messages during the phone. And maybe you gave a message and the response lacked escalation you were looking for, or the response didn't really address the concern at all. These are all challenges that happen frequently in the clinical environment. So we assure that you should all have some communication scenarios to choose from. But when you want to develop the scenario, you can ask yourself more questions. So what was the challenge? You know, what was the exact challenge? What was your communication style, or what mode did you use initially? Did you initially send a text and then you think you had to do a phone call, or did you have to go and speak to the colleague in person? How did you adjust your communication? Did you have to do that? If so, why? And did you choose those adjustments? So these are all ways that you can formulate a question, having those prompts that we went over, and then ask yourself more to really develop the question. So for the next example, I want to add a little tip or get you to think a little bit differently of how to prepare your responses. So you look at the question and you ask yourself, okay, well, why are they asking me this? Why would a management panel be interested in this question? And what else could I share to add depth and highlight my part of the story? So You want to tell us about a time you received valuable feedback to enhance your clinical practice. How did you respond? What did you learn from this experience? And how did you apply this feedback into your clinical practice? So looking at the question of why would a manager who doesn't know you want to know about feedback? A lot of people with new grads, you're constantly receiving feedback. I think the new grads who are on the call will be the first to share. But you know, it's something that's constant. And so a manager wouldn't be looking for somebody that's perfect, right? Like I want to hire a nurse who has no experience in feedback. Everything they do is on point. That's not the case. They're looking for someone that, knowing we're going to hire a nurse who's going to be receiving feedback, how have they received feedback in the past? Are they open to it? Do they look at feedback as an opportunity to grow? Do they look at an opportunity to improve their clinical practice, or do they become offended and, you know, and kind of deny the fact that they need to improve or change the way that they have learned things before and now have to formulate it and format their care to where they currently work. So when you're developing these questions and responses, that's another way to look at it. If you're having a hard time of so much information and you're trying to, you know, narrow it down to a 2-minute response, you could really think, okay, well, what would be really important here? Why would this be important for a manager to ask? Whether it be reprioritizing care, because that happens a lot. So what have they done in the past to reprioritize and take their plan and adjust and be flexible? When they have a challenge communicating, how do they adapt to that? How do they change it? How do they use it as an opportunity to learn and grow, rather than, well, I mean, I guess I'm not going to do anything, or I don't have any communication issues, right? It's always an issue. It's always something that we experience in the clinical environment. So that's just another way to look at these questions, and another way if you find yourself not being able to develop really rich responses, it's another way to look at it. Ask yourself, why would a management team be asking me these questions? And think of it in that lens. They want to see how you have performed and how you will in a future example or scenario. Okay, so we hope you found the information helpful, and then it was able to answer many of your questions. We understand that you might have some additional questions today, so we want to provide the opportunity to ask our residents your questions related to the interview process. But I just want to pause. I want to take everybody's attention for just a minute. And I want to just reiterate what we said at the beginning of the webinar. I know we had a little bit more people join after. So interview panels are still being reconciled. Once that process is complete, invites will be sent out. And additionally, we don't have the finalized number for positions that will be extended for hire this cohort. But we ask that during this Q&A session, once it begins, you don't use the time with the panelists to ask about interview invites. We're just sharing right now, the panels are still being reconciled, and then we anticipate invitations to be sent out once that's done. So before we begin, we'll clarify a few other things. When we talk about virtual phase 1, that is via Zoom. In person is for phase 2, which is unit level interviews. We often get asked, you can only interview for one panel. Many people want to know, well, if I don't get in on this panel, can you move me to another? We have so many people applying, and you know, there's only so many panels, and they are happening concurrently. So only one panel interview for each person. If you have non-panelist questions, so your question you have is not directed towards a new grad that's on our panel, we ask that you put that in the chat. We have our colleagues, Christy, Carrie, and Carly on the chat, and they'll be able to answer that. They'll direct you where you need to go. So we have our panelists. We have Amaya, Leanne, and Annalise. We're going to ask you to introduce yourself one at a time. So I'll call on you, and then you can introduce maybe your background, where you went to school, where you're currently working, and then we'll start getting questions from the audience. So we're going to ask the audience to use the raise hand feature in Zoom, and I'll call on you. So let's see, we'll start with Amaya. I'm going to stop my share, and then we're going to start with Amaya. Do you want to introduce yourself?
Yes, good morning. Thank you. My name is Amaya Clark, and I am a part of cohort 42. And before joining cohort 42, I went to San Francisco State. I was a part of the accelerated BSN program there. And I after, graduating, I took my NCLEX, applied, and was offered a position for F-Ground, which is a hematology unit. And I've been enjoying my time there. I'll be done with my orientation at the end of this week. So it's been a very great opportunity, lots of learning. I've been a sponge and just taking it all in, and it's very exciting at the same time. So I'm excited for all of you and wish you all the best in your upcoming journey with interviewing.
Thanks, Amaya. Next, we'll go to Leanne.
Hi, everyone. Welcome. My name is Leanne Collado. I am excited that you guys are here today. I was hired in G2 psychiatry. I graduated from Granite Academy in Concord, and I graduated August, took my NCLEX in September, and immediately started applying to new grad programs. It's been great here. Really excited for you guys. It seems intimidating, but you have such a great support system here. Everywhere you go, everywhere you look, everyone is supportive. So good luck with everything, and ready to answer your questions.
Thanks, Leanne. I apologize. Leanne is a newly wed, changed last name during the program, so I had your last name wrong on the first slide, but congratulations again. Just keep getting congratulations. Okay, Annalise, we'll have you introduce yourself.
Good morning, everyone. My name is Annalise Prestosa. I also went to Gurnick Academy in Concord. I'm from Unit M6, so the Advanced Lung Disease and Transplant Unit. And welcome, guys. I hope we can answer your questions today. It's weird because I feel like I was just here, but you guys are in for a great journey.
You're doing awesome. So we have a full audience here. Anybody have questions? I would ask you to use the raising your hand, and then we can get going on this Q&A session. George, do you have a question?
Hi, yes, I do. Thank you so much for this Zoom, and thank you to
my computer died.
Oh, do you guys hear me?
You're good, George. Continue. Let his computer just died. Don't worry.
So I actually have like a question. I did join a little bit later, around 11:30. But my question is, I'm not sure if I missed this portion, but how often are the evaluations with the nursing managers or like educators? How often are the check-ins done in regards to like seeing your I guess growth, to see if you're in the right direction of the goal of the nursing residency?
Maya, I see your hand up. Yeah, you want to take that one?
I can answer that. I've noticed on my unit, the culture is really like open door policy. A lot of the managers and other nurses, your preceptors, want you to check in frequently and just kind of just update them how you're doing. And so I would say like formally, you have during your orientation, there's 3 kind of formal check-ins that you have with your managers, your preceptor, and a representative from the nursing residency program. Each kind of unit, like a group of units, have like a person that kind of oversees us and like meets with us 3 times during the orientation phase. But I would encourage you to just communicate with your preceptor and your managers regularly and just kind of give them updates or let them know if you have any concerns, and just kind of build that rapport throughout because they're there for you and want you to succeed. So.
Okay, thank you so much, Amaya. So just to clarify, it seems like there's 3 check-ins, and one is with the preceptor, one is with the nursing residency directors, and then one with the nursing manager, correct? And it's like you just do your check-ins whenever you feel the need to, from my understanding?
Yeah, so it's like in each check-in, out of the there's 3 check-ins total over the orientation, and at each check-in you have your manager there, you have your preceptor there, and you also have the representative from the nurse residency program, and you have 3 of those over the course of 12 weeks. And then at any point of time, you can always check in with your manager or preceptor to check in and just let them know how you're doing or if you have any concerns. but 3 formal ones where you go over kind of the kind of pedagogy and like how you progress through the orientation.
All right, thank you so much again.
All right. And I think I will add to that too, George, just for a little further clarification. So Amaya got the first few, and then after actually your write-off orientation, we check in with you again, and then we check in with you at the 6-month mark. So there are actually multiple check-ins throughout that first year of the residency program. So hopefully that answers your question.
Yeah, I did. Thank you so much.
Perfect. Thank you. Tim, I see you have your hand up.
Yes, hi, good morning. Sorry, I also joined at 11:30, but this is a question to the folks who just recently got through the program. What do you feel about your interview helped you to stand out to move forward in the process?
Leanne, you want to take that one?
Yeah, sure. Hi, Tim. Nice to meet you. Glad you're here. Honestly, the interview is naturally, it's going to be very intimidating. I think what really helped me prepare and stand out for the interview is I prepare as soon as I got the interview and the okay that I was going to go do the interview panel online or through Zoom. I honestly prepared. So I honestly prepared for a couple of weeks. I made sure I created examples for myself. I don't do well if I were to wing it. I really need to be able to make sure like I know what I'm going to say, I'm prepared for it. So I used my experience as a psychiatric technician in the past. I use examples from then, and I use examples as a student nurse. You don't have to have medical experience, but you have plenty of examples you can use as a student nurse as well. And so I think what made me stand out is like ensuring that you're, including like patient safety, you're, like how you were part of the team and what you did to help solve the problem. And I think that in itself was just very, very helpful just because they, like when you're answering these questions, the question is about you. How did you handle yourself? How are you a team player? How did you provide patient safety? And it's always patient safety. And so, I think that's really, really important. And I think if you can do that, that's pretty great. And I think having the confidence in preparing yourself for it is like huge, like recording yourself with something I really did. I literally would have my iPhone and I would record myself talking to myself, which was kind of awkward for myself, but I would record it back and I honestly felt so prepared. Um, and I was like, oh, okay, I actually noticed myself being more confident on my phone and making sure you time yourself. That is within, it's like, it's huge because if you talk over 2 minutes or the strict time limit that's given to you, they will stop you. So make sure that it's less than 2 minutes or the time that's given to you. So hopefully that answers your question and it helps.
Yeah, thank you so much.
Thank you, Leanne. Emily, I saw your hand was up.
Hi, thank you for holding this webinar and answering our questions. I just wanted to dive more into the specifics and ask like what resources that you guys used. I know you talked about like your experiences, but is there anything else that you used to help with your interview? And if there's like any format that you kind of like suggest that we do, because like I know like the interview kind of goes in a flow.
Annalise, would you like to take that question?
I can. As far as resources, I kind of just stuck with what they talked about, like in today's webinar, the way that Letty said, how you answer things. I think you should really practice that way and really prepare. I think the timing thing is huge. At the end of the day, it's really about how bad you want it and how much time you put into it. So I went in with no experience in the healthcare field. So don't always go in assuming that you need to know everything, because really at the end of the day, I think personality is a huge thing that'll help make you stand out. So just be confident in yourself, confident in your answers, and you'll do great.
Thanks, Annalise. Leanne or Amaya, do either of you have any additional resources or tips you'd want to share?
Yeah, you go ahead, Leanne.
Okay. So I honestly agree with Annalise. Your personality is like huge. You know, go into the interview, smile, be comfortable. Like that's honestly the best advice because I remember when I was doing my interview, I was like smiling while I was talking, and sometimes you'll mess up and you're like, wait. And it's also okay to ask questions about you're not going to be timed like starting with asking a question, you're timed when you start answering. So make sure to clarify the questions so you're answering it correctly. But again, I agree with Annalise. It's really your personality. Smile and be comfortable because they don't ask really critical thinking or complicated questions, and you don't have to answer them like with so too complicated answers as well.
But all that is like very true. And I also just wanted to piggyback on just coming in with the mindset that the managers are there because they want to hire you. They're looking for people. And so I think changing my kind of mindset going in rather than being scared, just thinking like these people are here because they're looking for nurses, they're looking for us. And so just really like letting yourself shine and coming in organized and well practiced. That way you can really, as my peers said, let your personality shine because, you're going to be a person on their unit. They want to just know how you are and what your kind of like attitude is about it. And so coming in with a, positive attitude and like a can-do spirit and a growth mindset really will help you like set yourself apart.
Thank you, Amaya. All right. I hope that helped, Emily. All right. Abasola, did you have a question? Did I get your name right?
You did. You really did.
Okay.
Thank you so much. That was so good. Thank you all for hosting this. Once again, everyone has said this has been really helpful, especially interviews can be daunting. So this has calmed our nerves a little bit. I think my question was more so like, are they, this can be for the panelists, like, were they resources that were available to you, like when you felt like less confident on a skill or you needed to feel like reinforced in like a clinical skill? Is there a way, like, were there any refreshers that were available to like, I want to practice this on my own? Like, is there a way that's available?
Anyone have anything? Okay.
So, I'm sure all of you guys know, but Stanford is a teaching hospital, and I can't talk about how much I become confident in my work because everybody on the unit, from your management to the educators that you have, from like Letty, Christy, Carrie, everybody, if ever you feel like you need help anywhere, just let your preceptor know. If they can't help you, then there's like an educator on my unit, and then you could always talk to management. There's always somebody that's willing to help. Don't be afraid to ask either. Also, when an opportunity presents itself, please don't turn it down. If you've never done it, you could always approach it as if, oh, this is my first time seeing it, but I'd love to, get experience. I could watch you do it, and the next time it presents itself, allow me to do it. You're always learning something, so always take advantage, always ask for help. No one looks down at you for not knowing how to do it. Nursing, you're always learning, right? So always ask.
Thanks, Annalise. Okay. Isabella, I see your hand is up.
Hi, and good morning. Thank you guys for hosting this webinar. It's been really helpful. My question is how you guys have seen yourselves grow as both nurses and people because of your time in the program.
I think it's that's a great question. It's really easy to get imposter syndrome. This is like obviously a very big deal. Like, a lot of our first, nursing jobs and, kind of in our career. So it can be very kind of like overwhelming, but I just try to kind of shift that overwhelming feeling into like an excitement and then like an opportunity to like learn and, like I said earlier, just be a sponge. And as the other panelists have mentioned, like there's just so many opportunities to learn, and like it can be kind of like, oh my gosh, I've never done this before. This is scary, but you're supported by the other nurses on the floor, your preceptor, the charge nurse, the float nurse. So just kind of also feeling like this is, if there's any time to do it, it's now because I have all the support as well. So there's been a lot of opportunities for me to just kind of like, own your own nursing care and really like take the initiative and like own your practice. So it's been great, empowering. So
Thank you. Leanne or Annalise, anything you'd like to share as well?
Yeah, I also agree with Amaya, like really just own your practice. I think that entering the program, it's very intimidating, right? But like I remember like on day one of the main things that was told to us as new grad RNs is, you're not going to know everything. That's why we're called new grads. So we're here to learn. We're here to like take time to like take everything in. And I know it's intimidating even being on the floor. I remember on the first day I was on the floor, it's like, okay, let's pull meds. And I wasn't really familiar with Omnicell. Like my nurse before, like didn't really, or in clinicals as a student nurse, like didn't really explain Omnicell to me. So just know that you're like extremely supported here. And then when you're assigned preceptor and the unit managers and my mentor, which is Christy, like and when they all check in, they're not just asking you like how you're doing, like are you staying above water, are you drowning, but they're also asking you like how you are doing outside of the nursing program, which is like really helpful to me because I can actually vent to my preceptors and my nurse mentor about, like how I'm like handling and balancing my outside life and work. And it's really helpful. And I know like sometimes it's intimidating going in and driving to work, but it's really great knowing that you have such a supportive team. And I couldn't have asked for like a better new grad program. So I don't think I've lost myself within the process because I feel like I am still myself, but with my own bubbly personality. So feel free to just be yourself, show that personality even after the interviews, and I'm sure your team will love you, honestly.
I piggyback. Sorry, just want to reiterate how as a nursing student, I think you're scared because you think you're expected to know everything. Very textbook is what you're used to in the program. But I feel like I've been very humbled in the sense that nursing, I think therapeutic communication is like number one. So again, just be yourself. Remember, you're not going to know everything. But yeah, it's very humbling.
Thank you. Okay, Bernadette, I see your hand is up.
Hi, thank you all for putting this webinar on for us. I had a question. I think the three nurse residents, I think you all are BSN nurses, but do you happen to know anyone in your cohorts who are doing an RN to BSN program while in the residency? And if so, are they able to sort of manage that work life school balance?
I can probably answer this one. I actually know people who are actually doing that. Yeah, they actually got hired when they have their associates. And I believe I can't remember who it was, but I remember that they were explaining to me how they are taking like one or two classes here and there, but it's not, the job at Stanford is, it's exhausting, depending on whether you're hired for rotating or but the 12-hour shift is exhausting, but there is still time on your days off that people have told me that they're studying or they're even studying for like their uh, nurse practitioner. And so they're able to balance everything. We come in like 3 days a week, and then sometimes we'll come in for our seminar, but there is still time to do that. If you're worried, you can definitely balance it with good time management.
Thank you.
Thanks, Leanne. And I'll add that nothing that happens within the residency program is outside of work hours. Everything is a part of work hours. So if that helps to make you feel a little bit better about that decision or choice, anything in terms of like that RN to BSN bridge that you're doing, it won't, like, your work hours are your work hours. And then after that, you don't have homework or anything outside of that you're responsible for.
Okay, great. Thank you, Christy. Thank you, Leanne.
You're welcome. You're welcome. Okay. I'm not seeing any other hands at the There's Nancy. Nancy, go ahead and ask your question. You came right in.
Hi, Bernadette. I just wanted to give you some insight too that I had two friends that are in the program and they deferred their BSN program for a year. So they took a little bit of a break in order to focus. And I think most programs offer that ability to defer and continue later.
I appreciate that, Nancy. Thank you so much.
Yeah, it's definitely a personal choice.
Yeah. We have a question in the chat from Olga. Tell us about the time from the day you accepted the position to the day you started the new grant program. So what should be done in the time frame? So what's your experience for the panelists who would want to answer this? When you received the offer, what is the work you had to do, and what was that time frame? You could share that process.
Yes, I know there's no sort of like official kind of like homework or things that you have to do, so to speak. I kind of just brushed up on my own, like, looked through my notes and I knew like the type of unit I would be on. So I kind of brushed up on some commonly diagnosed, common diagnoses as well, just to kind of like not be totally shocked when I got onto the floor. But I think that's also just like a personal preference. It had been some time since I had been in school. So I just wanted to kind of brush up just for my own comfort. And yeah, I think it just kind of depends on your own preference.
And to add on to that, just to kind of give you like a timeline, I remember I got my offer letter February 9th, and then we didn't start our program till like March 17th. So within that time period, I did the same as Amaya, kind of reviewed notes for the unit that I was hired to, which is psychiatry, inpatient psychiatry. And a lot of the things that they make you do is kind of like you got to do your blood work, you got to get your ID, you got to prepare. I think you have to sign up for like your uniforms. So you get uniforms when you are hired, and so, but there's nothing in particular like homework, if that's what you're wondering, that needs to get done specifically. It's more like onboarding things that I completed in March actually. So yeah, you don't have to worry about doing too many things other than COVID shots if or like flu shots or anything. But yeah, nothing like in particular that needs to be completed. Yeah. Hopefully that answers your question.
I think brushing up is great. I also did that. But again, the things that I went over, like the medications I thought I would need to use, ended up I don't see any of them. So you're always learning something new. But as far as like prep, I would recommend, just because I know it's hard for other people, 500p, 300p are insane buildings. You could get lost very quickly. Parking, always figure out like transportation, because you always want to be on time, right? So just figure all that good stuff out, like the map, like get to know the hospital. Yeah.
I have a question for the panel. I was trying to answer one in the chat, but I'll get back to that chat in a second. I have a question for the panelists. Were there any questions that threw you for a loop? So we're talking a lot about preparation and practicing, but was there anything that you had to stumble upon, or did you feel pretty prepared in this, recommendations that we gave?
I will say I'm very much a planner, and I think having this webinar and then doing my own practice and making my own kind of, questions and, workshopping my responses that I wanted to talk about, timing myself. I felt the only like thing that threw me for a loop was just kind of like, oh my gosh, I have an, interview. I'm so excited. It wasn't like things I had never heard of. I felt very prepared because of kind of the bank of qualities that they tell you that are going to be talked about. If anything, it'll be like exciting because it's like, oh yeah, I know that. Like I'm gonna, I already have a story from clinical or, something to talk about. And it's definitely, the nerves will probably just be because it's a big deal that you're having an interview and less about, oh my gosh, like I've never heard this before. Hopefully that helps.
I have a question from the chat. I'm just gonna, I'll ask some questions. I'll keep you guys busy. So we have a question in the chat from Jennifer. May I ask, given the interview opportunity, what makes you stand out from other applicants apart from your readiness during and the interview and your personality? So wanting to know, is there anything else that you could think of that made you stand out looking back?
To be honest with you, I honestly feel like one thing that when I was done with my panel interview and I was chosen, I actually asked those who had interviewed me, like, what about me, like, stood out, that why you chose me, just because, I was just curious. And they told me it was really my personality, right? Like, I think it was more so like I was just trying to talk genuinely to them. But I really, really prepared for the interview. When I tell you I was recording myself, if you were to go on my iPhone, you would just see all my recordings that I probably didn't even watch. I just kept recording myself and I would rewatch that video and then I would record it again. But I think for me, like, as long as you have, I think I came up with like maybe 20 questions that could potentially be asked, and I made sure like I memorized them. That way, when I'm actually answering the question, it just kind of comes naturally to me where I'm like, oh yeah, I got to add this part and always include the patient safety. And I think that was like very, very helpful in the timing. But they're really looking for your personality, like whether they can get along with you, right? Naturally, they want to get along with nurses who are open and have, like a really fun personality and like, don't go into the interview, like not smiling and too serious. They want to see that personality come out and through your answers. And so I think by preparing with your questions, it's extremely, extremely helpful. I like highly recommend preparing and recording yourself. Hopefully that answered your question.
And to piggyback off of what Leanne said, also just talking, like, share your answers with people who you may not be super comfortable with talking to, because you're not going to know your managers or the people who are going to be interviewing you. So it's like also nice to just like have a new face that you can, practice your responses with, just so you can, get feedback and kind of just, be candid and, help you be prepared for just, a little bit of the unknown with like who's going to be on the other side of the screen.
Not to be daunting or anything, but if you don't prepare, almost want to say, like, I promise you won't do as well as you think. 2 minutes is not a lot of time. And when you're trying to, like sell yourself, essentially, you go off on tangents. It's very easy. And don't change your answers based off the other candidates. Stay true to what you practiced, all the qualities they listed. I would do bullet points. Also, don't type out like paragraphs and think that when you're reading them, 2 minutes, you can read it fast, but you don't want to sound rushed during your interview. Also, I think your loved ones, like your family, whoever you're with, are your biggest critics. So practice with them, because if you could get it down in front of them, getting over that hurdle of being nervous to speak in front of somebody or other people, I think it really helps. So really practice.
I also wanted to add on to Annalise as well, is like, make sure you're not reading anything. They can tell if you're reading, like if you were to put anything on the computer and you're trying to read your answers, they can tell. So make sure you don't read and that you genuinely like just know your answers and how to naturally answer them.
That's really great advice from all three of you. Ricky, I see you have your hand up. Question for our panelists?
Yes. First, I wanted to say thank you all for hosting this webinar. Really appreciate everyone coming out, answering questions. My question was, let's say if you don't have certain answers to the interview questions, how could you get more experience and like keep yourself up to standards?
For me, I really just tried to I think on the slides you'll see there's like this list of qualities, and I really just tried to find 5 stories from clinical, from volunteer, from in a setting like that where I could highlight something because, because they give it to you in advance, you really want to try to make sure that you have it there so you don't get, stumble or feel like you fumbled like the question just because you didn't feel like you had it. But I think most of mine were from nursing school, just like clinical rotations. And even as like a student nurse, I could still kind of like hone in on how I use cultural competency or compassion or advocated for a patient. Like, just take some time to workshop and like think over your clinical experiences because you probably have done several of those things. You just may not have like in the moment been like, oh, right now I'm, advocating, or right now I'm, doing service recovery. So just, take some time to really just brainstorm and have them all compiled of like, in this situation, I'm using these sets of qualities so that you can feel prepared for any of the qualities that they'll ask about.
Thank you.
Thanks, Amaya.
Christy, I have a question. How did you manage your nerves during an interview? Was that a factor for any of you? How did you manage it? How'd you play it off? What'd you do?
I definitely took a deep breath going into it, like maybe 5 of them. I think preparing in advance helped a lot. But I mean, naturally, you're going to be nervous, and that's totally fine. Even if you show them you're nervous, that's totally okay as well. I think I might have stumbled one of my answers where I like probably stuttered one of my answers, and I told them, sorry, like, let me just hold, sorry, I'm just a little nervous. And they were totally okay with that. They were like, that's no problem, don't worry. But taking a deep breath, waking up in the morning, maybe not studying anymore, just take that morning, drink coffee, eat a light breakfast. And that helped me prepare for it. That way, I'm not going into the interview hungry and, just like say a little meditation to yourself and just mentally prepare yourself. And just know you're going to do great. Prepare, let that personality show, and you'll do great because they want to see your personality come through. They don't want to see, you kind of, fake an answer or anything. So, but I'm sure you guys will all do great. Just prepare.
Yeah, remember to breathe. Self-talk is a huge thing. So remember, you're here for a reason. You've gotten this far. Yeah, you'll do great. Just breathe. Breathe, breathe, breathe.
Yeah, I think you guys are all really hitting the nail on the head with this. I think really it's about preparation. And I think even though you might feel like maybe you don't have all the answers, and maybe depending on your different experiences that you might not have this or you might not have that, I think you would be surprised at everything that you have had. So if you haven't been journaling, maybe reflecting on some debriefs that you've had with your clinicals, maybe some assignments where you had to kind of share certain experiences that you had, talking with your peers and kind of like, oh, how to remind me again, how did this, what happened when we were at clinicals the other day, if you can't remember something. So I think spending some time with that, the more you prepare, the more you're going to feel like a little bit at ease and feel like you are able to answer the questions that they're going to give you. So what other questions? What other questions do you guys have? What about, we've talked a lot about being prepared, about the, nerves. What else did you guys do? You felt like it was maybe like the thing that really helped you to like feel successful. We talked a lot about preparation. Anything other than what we've discussed right now that you want to share? Questions? Did you go over a lot of them? Who did you work with? Leanne mentioned recording herself a bunch.
Honestly, yeah, talking to myself in the mirror, just kind of knowing my own body language, and then just kind of, recorded myself to know how many ums or, things like that, I'd say. And then also just like I was saying earlier, just like, talking with friends and family members, like, hey, I have a big interview coming up. Like, would you mind reading me these questions in random order? I just really tried to make like my family and community kind of a part of the process. And then that along that, with that, they kind of supported me and hyped me up, which, helped kind of alleviate some of the stress too. So just kind of, maybe making it a holistic thing can really help ease some of the nerves and just simultaneously allow you to prepare for the upcoming interview.
Thanks, Amaya. Okay, any other questions? We'll give you guys I'll give you guys a few minutes to think of them, just to, kind of count here to 10. And then we'll give you back some time if no one has anything else they want to share or ask.
Christy, can I just make a comment just based on some of the questions in the chat?
Yeah,
can you hear
please.
me okay? Okay. Just wanted to share that I know some of you are concerned about not having experiences or scenarios that will answer the question that you're going to be asked. Know that the questions are general enough so that you will have had an experience that you can speak to. So there's not going to be a question that says, tell us about a time when your patient decompensated and how did you manage, right? Because some of you may not have had that situation. The situation will be more general about, tell us about a time when you noticed a problem or a concern. And the concern can be my patient, was confused or had increased pain, or they didn't have a clear discharge plan. So they're general enough where you will have scenarios and experiences from your clinical rotations that can answer the question. The thing to remember is that in behavioral interview questions, yes, they're asking you about a scenario you've had, but then they're going to follow it up with, how did you respond? Or what action did you take? That is the meat of your answer. The hiring managers want to say, what did Isabella do? Or what did Annalise do? How did she respond to the situation she just told us about? So think about a very clear experience in which you were able to respond creatively, innovatively, you showcased your best self. That's what they're looking for. So while the experience helps set the scene, that is actually not the spotlight of the answer. So I just hope that clears up because we had some questions in the chat. Thanks, Christy.
Thanks, Carrie. Corey, question?
Yeah, hi there. I just have a quick question based on what Carrie just shared. Would it be okay to reuse scenarios that we talked about in our short answer portion of the application, or should they be totally new experiences that we share?
I think it's fine you can reuse them. They will have seen those though already, so know that they will have had an opportunity to see them. I think it's fine if you want to reuse them and share them again. I would just make sure that you're sticking to the facts, not trying to, add anything extra to them too much, because then it's going to look like there's a discrepancy from one to the other. So just be careful and mindful of that. But yeah, I would say if that's a story that really lends to the question they're asking you at that time, absolutely.
Thank you.
Leslie, did you have a question for the panelists?
Yeah, hi, I'm Leslie. Well, I think I'm piggybacking off of what was just asked. I want to hear a little bit about the preparation for the second panel interview. I'm already moving on to the second. All of us hope that we are. And I'm just wondering if there was any difference in your preparation for the second interview. I understand it might get a little bit more specific to the candidate and about them as a person. But did you find that you prepared differently in any way? And was there any overlap or repetition in what you saw from the first to the second interview?
Great question, Leslie. Panelists, I'll let you guys decide who would like to talk about that preparation for the second interview.
Yes, I would say preparation for the second interview, I knew that, there may be some behavioral questions, but they're also maybe kind of switching and more so asking questions about me, and maybe even a clinical question based on what unit you're on. So for me personally, that did happen. I'm on a hematology unit, so we have a lot of patients who have blood diseases such as like leukemia. And so they asked like, what would you do in a scenario when a patient has neutropenic fever? So because I knew like the kind of population I would be, potentially caring for if I were to be hired for that unit, I did brush up on some kind of like med surgery, kind of cancer, basics, just because I didn't know that they were going to ask that question, but I just wanted to be up to speed just in case it happened. But I think in that moment, that was something that I still was kind of like, oh my gosh, they just asked me that question. So I kind of asked them like, like, that's a good question. Like, let me think about that. And I really paused to kind of collect my thoughts because, it was kind of throwing me a little bit. So I think it's important to just like kind of prepare for some clinical questions. But they also weaved in some questions about me, like, what do I do in my free time? And how do I manage stress? Or, they also want to just get to know you. So I think that was also a great opportunity to let my personality shine. And it wasn't that I had other people who were also interviewing. It was just about me and like my experience. So I think it's important to, if you make it to the second part, really let your personality and your passion for nursing and the field that the unit you're going to be on shine, because, you're almost there at that point.
I wanted to add on to Amaya. That's a really good question. For me, same thing as Amaya. I didn't have to worry about timing, if that helps. For the Zoom interview, your time where they have to be like 2 minutes or less. For the in-person interview, I wasn't timed. They told me I wasn't timed, and so that was really helpful because I did time my answers. But I agree with Amaya, they do want to see your personality. I had most of my questions or behavioral questions kind of similar to the Zoom interview, and then they did throw one clinical situation based off of my specialty, which is psychiatry. And, but they weren't difficult questions. I was able to use an example through my clinical experience. The questions aren't too complicated, and you don't need to answer them with complicated answers. I think as long as you describe the situation, how you took part in that situation, and then the solution is like what they're really looking for. But I think one important thing to also consider going into this in person is also to include like practice your introduction. Like that's a really big thing that I made sure I practice. Yeah, it's on your resume. You have to bring your resume in, but they're actually following your resume to make sure what you say matches that resume too. So make sure you have like a good introduction of yourself and let your personality show and shine. Hopefully that helps.
I can add on also. I feel like I was more relaxed going into the in-person unit interview just because when I got the call, they let me know that it was more of getting to know me versus how it was on the panel interview. It wasn't timed. They weren't really stuck to like certain things that they were going to ask. And when I got there, I worked on my intro. I made it different from what was on the panel because they were there on the panel also. So it was more of allowing them to know who I am on like a deeper level. And I was able to have more time to kind of describe what brought me to nursing. They also asked behavioral questions, and then I did get like 2 or 3 clinical scenario questions. But to put everybody at ease, I bombed one of the questions, right? So everybody's applying for nursing. Everybody's gonna know like clinical sets like lab values, which they'll ask. But what I did to rebuttal, I told him I actually don't know how to answer this question, but with nursing, let me figure it out. Let me get there. I'll tell you where I want to start and what I would do to answer that question, which I think is what really set me aside from all the other candidates versus me just trying to answer and not having like any rhyme or reason. So owning that you don't know everything is great. You're a person first, right? So just show your personality and you'll do great.
Thank you.
I just wanted to add, my manager also said like in that part of the interview, they were just saying like, we were on the we were on the panel like a couple of days ago, and it's okay if you reuse the questions or the responses, because they knew like there were other nurses there, like the unit educator and another nurse who had not heard those questions yet or those answers yet. So if you do reuse something, I don't think it's going to be your like Achilles heel and it's going to be like you're not going to get the job. It's if it applies, like speak on it.
Thanks, Amaya. All right, Leslie, did you get more than you thought you would? Good, good, good. All right, I saw another hand, but then it disappeared. So I'll give you guys a minute or so. Any other questions that we can help to answer? Okay, well, I don't see any other hands up. So I will go ahead and give you some of this time back. I hope you found that today's webinar was helpful. We had previously put the link to our career site in the chat so that you can visit it. It has kind of a section with other questions, more so related to application, but there is also a place where you can email if you have other questions, newgradrn@stanfordhealthcare.org. So I hope that this was helpful. We will have the recording available on our career site by the end of the week for any of you that are wondering. Okay. So thank you to our panelists. We appreciate your time today. You guys are fantastic. We so appreciate you. And it was great connecting with everyone else here. I hope you have a great rest of your day. Take care.
Good luck, guys. Thank you. Y'all got this.